Hey guys, Dr. Del Mills here with personalfitness.com, where we help our clients, who happen to be mostly women, lose the weight for good, create optimal metabolic health, which happens to be healthy hormones, healthy blood sugar, healthy cholesterol, things like that, and feel sexy again, obviously. Today I want to talk to you about life after COVID-19. Yes, there will be life after COVID-19. So specifically I want to talk to you about why your poor metabolic health, things like chronic inflammation, excess weight, diabetes, hypertension, low HDL, hormone imbalance, may leave you susceptible to the next coronavirus and what you can do about it. So why your poor metabolic health may leave you susceptible to the next coronavirus and what you can do about it. You see, this pandemic has been very hard on all of us in many different ways. Unfortunately, some of you have watched your loved ones suffered and died, and for that I offer you my deepest condolences. Personally, I've known several people who have contracted COVID-19. Some, like my mom and some of my clients, have recovered. Others, unfortunately, are still dealing with a myriad of adverse health consequences of being infected. Fortunately, there is a light at the end of the tunnel in terms of a vaccine. However, a vaccine is only a part of the solution to this virus. I say it's only a part of the solution because it doesn't help with future viruses, right? It only helps with this one and may not even help with other variants of this virus. So while it may be a part of the solution to this virus, it may not help with future viruses because there have been other coronaviruses and there will be others. This won't be the last one. So what is important? Your metabolic health. As I've been saying for so long, your metabolic health is more important. Here's why. In a nutshell, a vaccine helps with one virus. But optimal metabolic health will help you to achieve robust immunity, balanced blood sugar, balanced hormones, reduced inflammation, healthy blood pressure, healthy cholesterol levels, and of course, helps you to maintain a healthy weight. But here's the deal. Before you can even get to optimal metabolic health, you have to first make a few shifts that's necessary. And one of the most important ones is this. So you ready for this? One of the most important shifts you need to make is this. Is to acknowledge and realize that your doctor may have been lying to you for years. Now I know that's controversial, but it's the truth. Your doctor may have been lying to you for years. You see, things like diabetes, heart disease, hypertension, high cholesterol, obesity, hormone imbalance. These are all adverse lifestyle health conditions, which means that they all have a lifestyle solution or a lifestyle cure. That's right, a lifestyle cure. So why do I say that your doctor may have been lying to you for years? Because every doctor knows that you can reverse these conditions through lifestyle interventions, and often without medication. You see, the research is very clear, but most doctors don't tell their patients that, do they? Instead, they say, here's a prescription. This will help you to manage your diabetes, your heart disease, your high cholesterol, your hypertension. But it's a big lie. There's no managing these health conditions because they're only going to get worse. Believe me, folks, I know. See, for years I've watched my mom suffered from the adverse effects of diabetes, hypertension, heart disease, and while taking dozens of, at least a half a dozen medication for all of these different illnesses that her doctor told her that she needs to manage, also taking other medication, pain medication from, the pain of chronic inflammation that develops over the years. And the only thing that helped, she only started to get better when she decided to take my advice and change her lifestyle. That was the only thing that helped. So here's the deal, right? It's a well-documented fact, supported by dozens of studies, that lifestyle diseases are things that can be reversed if you catch them early enough so you don't have to live with them. And how this affect your chances against viruses like COVID-19? Well, poor metabolic health, high blood sugar, overweight and obesity, low HDL, high LDL, cholesterol, high blood pressure, leads to the buildup of chronic inflammation in the body, which unfortunately is going to put those with these conditions at a very high risk for severe illness and complication from things like pneumonia, infections, and of course, respiratory viruses like COVID-19. Now here's the good news. We know for sure that excellent metabolic health may reduce your risk of severe illness and death from any cause. As I often like to say, folks, excellent metabolic health is more important than any vaccine. Why? A vaccine protects you against one virus, but excellent metabolic health reduces your risk of severe illness and complications from diseases, infections, viruses like COVID-19 and anything else that may show up in the future. So wouldn't it be better to get healthy than to be running scared the next time one of these viruses show up? So now what can you do about your poor metabolic health? Well, here's the first thing. You can start to make small changes in how you move, eat, sleep, and live. I have a video of that, so check out my last video on that. I made a video on how to make small changes in how you eat, move, sleep, and live. Ask yourself this question. What one healthy habit are you willing to adapt right now, today, that can make a difference in your body, your health, and your life? Just one healthy habit that you're going to practice every day, starting today, in perpetuity. Hormone imbalance, weight loss, immune function, high blood pressure, high blood sugar, high cholesterol. You can affect all of these conditions just by adapting one healthy habit today. The question is, are you willing to do that? Now here's the second thing you can do, especially for you ladies. Start creating healthy hormones. One of the unfortunate facts about a coronavirus is that it hijacks your hormones. And hormones are some of the most important messengers in your body because they're involved in virtually every process, from physiology to behavior. So one of the most important things you can do is to learn how to balance your hormones naturally. That is the topic of my next video. We're out of time today. That's all I've got for you. But in the meantime, check out my next webinar. If you haven't signed up for my webinar, Get Your Sexy Back, sign up for my webinar. You can go to personalfitness.com. If there isn't a link below this video, you can sign up at personalfitness.com for my next webinar, Get Your Sexy Back. I talk about the 5 shifts my clients are making to lose the weight for good, create healthy hormones, healthy blood sugar, healthy cholesterol, and to feel sexy again. Okay? So sign up for my next webinar. You can also sign up for a health strategy call with me, a 1-hour coaching call on the phone with me. Right? So go to personalfitness.com and you can sign up for my webinar. You can sign up for a health strategy call. I get on the phone and I talk with you about, well, where are you? What's causing you pain? What is happening in your life right now? How do you bridge the gap between where you are and where you want to be? And how do we do that as quickly as possible? I've talked to dozens of women every month from all over the country. And I guarantee you it's an hour that will be well worth your time. Again, subscribe to this video. If you haven't done that, subscribe to my videos because each week I create a new coaching video about a different topic of interest to you based on what I hear from the people I talk to on a weekly basis. Okay? I'm Dr. Del Millers, and as usual, may the best of your todays be the worst of your tomorrows. You take care now.